Hello, everybody, and welcome to Neuroscience News. I'm your host, Ross Hillary. In this week's installment, I'm going to be talking to you guys about the mysterious phantom limb syndrome. Now, what is phantom limb syndrome, you might ask? Well, a phantom limb is the sensation that an amputated or missing limb is still attached to your body and it is moving appropriately with other body parts. Interestingly enough, approximately 90 to 98% of individuals with an amputation experience phantom sensations in their amputated limbs, and the majority of these are painful, unfortunately. In this episode, we'll take a look at what causes phantom limb syndrome from a literal and neurological basis, as well as what we can do to possibly help out these kinds of people that are affected by this disorder.
Phantoms appear immediately in 75% of all cases. As soon as the anesthetic wears off and a patient whose limb was amputated becomes conscious. But in some individuals, the appearance of the phantom can be delayed by a few days or even weeks. Once the phantom appears, the duration of the existence of the phantom varies drastically from patient to patient. In most cases, the phantom is present initially for a few days or weeks and gradually fades from consciousness, but in some, it may persist for years or even decades. One such patient reported a phantom which persisted 44 years. Even more interesting is the fact that some patients are able to recall phantom limbs at will after its disappearance if they use intense concentration. The most common phantoms are both arms and legs, but other such body parts have been reported, such as breasts for women who have mastectomy, and sometimes even internal organ removals. Patients often comment that the phantom occupies a sort of habitual position. For example, an arm that is partially flexed at the elbow, or a leg slightly bent at the knee. However, sometimes the phantom can assume a different and sometimes painful posture. In one case in particular, a soldier who had a grenade explode in his hand while in combat was left with a phantom hand stuck in a permanently clenched and painful position. Another interesting behavior that stems from a phantom limb is called telescoping. When the phantom does fade from consciousness, it usually does so completely, but in about 50% of cases, the arm, for example, may become progressively shorter in the patient's mind until they are left with just a phantom hand attached to what is physically remaining of their arm. The reason telescoping occurs is mostly unknown, but it is suspected that the brain is clearly confronted with mixed signals. Anyway, let's move on to the most important part, the science. As we said before, the brain is receiving mixed signals. Let's see what's going on inside these patients' brains. Advancements in medical technology, like the MRI and MEG, have helped scientists and doctors gain a much better understanding of why phantom limbs exist. Until recent times, the most prominent theory for the cause of phantom limbs was that they were due to irritation in the severed nerve endings in the limbs, called neuromas. When a limb is amputated, the nerve endings can become inflamed and then send anomalous signals to the brain. These signals were thought to be interpreted by the brain as pain. Treatments following this theory were mostly unsuccessful and most often resulted in an increase in pain for patients. By the late 1980s, Ronald Melzack recognized that this theory could not be correct and instead proposed the theory of the neuromatrix. Melzack thought that the experience of the body was created by a wide network of interconnecting neural structures. Then, in 1991, Tim Pons showed that the primary somatosensory cortex undergoes substantial reorganization after the loss of sensory input. Then came Dr. Vilayanur S. Ramachandran, who has since become the forefront of phantom limb research. Dr. Ramachandran proposed that the phantom limb sensation could be due to this reorganization in the somatosensory cortex. a part of the brain located in the postcentral gyrus, which received input from the limbs and body. Dr. Ramachandran illustrated this theory by showing that stroking different parts of a patient's face who had an amputation and phantom limb led to perceptions of being touched on different parts of the missing limb. Essentially, there are two strips of the brain that run from ear to ear across the top of the head called the sensory motor cortex. One strip is used to control all movement in the body, and the other registers the sensations all over the body. In fact, we can actually map out a person's body on these strips. When a person loses a limb, the neurons and brain cells inside these strips that used to control and feel the sensation for that missing limb become repurposed for nearby areas. For example, if you lose your left hand, the neurons that used to feel the sensations of your left hand start feeling the sensations of your forearm, bicep, and sometimes even face. However, sometimes the brain forgets the limb is missing and mistakes the firing of the neurons in what used to be the hand area for a tickle or itch on the phantom hand. The brain thinks that the limb is still there, so it is able to perceive these feelings. Thus, when the phantom is stuck in an uncomfortable position, the brain continues to fire these neurons, and pain is constantly perceived as being present. That being said, what can be done to try and calm the brain down, you might ask, and stop it from sending these signals? Well, Dr. Ramachandran came up with just the plan to help these kinds of patients. He realized that the brain is more receptive to visual signals, more so than physical signals or sensations. Since that is the case, if there was a way for patients to see his or her phantom limb, maybe it would be possible to move it into a more comfortable position. In 2012, Dr. Ramachandran reported the case of a 57-year-old woman who, after a car crash, had her hand amputated. He created this mirror box for her to use. By creating a reflection and looking in the mirror, this allowed the patient to gain visual feedback from her phantom limb. Dr. Ramachandran trained the patient for 30 minutes a day, having the patient move her real hand while looking at her phantom one. After 2 weeks, she was able to move her phantom fingers and was relieved of all pain. But why can't the brain send these signals to move the limb in the first place, you might ask? Well, in 2012, another experiment was conducted that showed that the movement of phantom limbs using this mirror method are real movements, meaning they actually involve the execution of a motor command inside the brain. Amputees can also create imaginary movements of their phantom limbs, but the brain knows that the limb did not change the position because it cannot receive any feedback from the limb. The mirror technique allows the brain the ability to receive feedback, thus convincing the brain that the limb has moved. This breakthrough research has been providing relief to many phantom limb patients. There is still some mystery regarding phantom limb syndrome, but in recent years, neuroscience has been able to answer many of the questions that were unknown before. Hopefully, this trend will continue and we will be able to further understand phantom limb, as well as other mysterious neurological disorders.
And there you have it, phantom limb syndrome. Thanks everybody for watching my video. Hopefully you learned something. And until next time, I'm Ross Hillary. Good night.